We are here today at Acacia Premier Hotel to release the report of our end-line evaluation for the program that has been running for the year running 2018-2022. It has been a school-based program on alcohol and other substance prevention for infant children within Kisumu County, mainly Kisumu Central, Kisumu East, and Moroni sub-counties. Yes. So this program has been an approach that was life skill-based. We were working with the NACADA report for the physical institutions 2016 that showed us that the age of early onset use of alcohol was as low as 10 years. The report indicated that schools where children spend most of their time was the key area where the introduction to drugs, alcohol and substances was the primary ground. So our program was tailored to work in the school so that we would incorporate life skills into the existing curriculum. We all know that the Kenya curriculum has been championing for the life skills education, which is in the early stages. So us as Bluecross Kisumu, we went in to partner with the schools and with the Ministry of Education with the empowerment from NACADA to be able to find a system that would incorporate what we wanted to achieve. We must say that in working with NACADA in 2020, we were able to launch a life skill manual that incorporated education in alcohol and other substances within the schools. So we have run this program reaching youth in these schools and sub-counties, and the report that we are launching today, for us the key factor is that of the respondents reached 95% of the caregivers who are parents who are also able to go through this life skill education have reported that they have observed change in their children. So there has been behavior change that has been reported positively, and this has also led to the change in even school performance and the cooperation and even the family cohesion within the family, even as a unit.
You feel there's progress made?
There's been tremendous progress made. We've had feedback from NACADA. My regional director, which has here today, has really worked closely with the program from its inception. This is the key stakeholder that has really given us advice, capacity building in different departments, and has enabled us even in policy formulation. We must say that our key achievement and the sustainability that is coming up from this program is that working with education and the guidelines that were released in 2021 for the basic education, we have been able to, they were able to find when the schools had already built enough ground for them even to be able to push through their alcohol policies. We've also had feedback from the learners themselves because the program was centered on empowering children and youth to fight for their own rights. What happens when you tell, when you talk to young people about drugs and alcohol, it looks like lecturing or talking down. So the program was meant to empower youth with the education on alcohol and other substances, but mostly to be able to empower them to be change agents. So our advocacy has been child and youth-led, where the children and the youth themselves, having been mobilized in the Bluecross club that exists right now in 24 schools within Kisumu County, they were acting as the change agents and the pacemakers. So this group of children who are here today to also report what they have been doing, have been able to come up with activities within their schools to address issues affecting the youth themselves. They have set the discussions on alcohol and other drugs abuse. They have been able to identify themselves the risk factors affecting them, the vulnerability issues in their communities, and they have been able to educate one another on how to stay safe. And because of that, we found out that the rates of consumption has come down. Outcomes have showed us that because of the sensitization, they have been able to be very surveillance, and the surveillance in the school has improved. They are able to identify the risk factors, report those who are in use, and they report them not to for punitive measures, but to be able to receive help. And we have seen the numbers of children seeking counseling services and rehabilitation also going up, and most of them have been able to go back to the line and be able to continue their education based on our aftercare services that follows up with them. So this program has shown us that the rate of consumption has gone down, and one key recommendation that is coming out today is that indeed life skills should be strengthened, and we hope that other civil societies, government departments, and other people in this field are able to adopt our report and even be able to strengthen the life skills education and be able to adopt our manual, which has proven very effective in being able to reduce the rates of alcohol consumption, the exposure factors, the vulnerability areas, and addressing issues. I must say that we were not limited to only alcohol and drugs. Because of the empowerment that the children have been given, they have been able to address other key issues that compound even for them, including sexual and gender-based violence, child rights, child participation, and all other issues that are affecting children.
Thank you very much. name is Patrick Ogura. I'm the Director in charge of Corporate Services of Canada. We are here today to witness the launch of the implementation of the program that Kisumu has implemented. As NACADA, we are a national agency that is mandated to coordinate the campaign against alcohol and drug abuse. We recognize the fact that the campaign is multifaceted, and therefore we recognize efforts of all players, including government and government actors, and even the CBOs like Bluecross Kisumu. In the implementation of our program, we have advocated a life skill program which has shown a lot of impact, especially for our kids within primary and secondary school level. The research that we did in the secondary and primary school level indicated that the prevalence usage of alcohol at secondary is about 22.3%. and at primary school is about 7.2%. However, we noted that one of the learners, the earliest, had started using the alcohol at the age of 4 years. So, based on the results that have been issued by Bluecross, we see that Bluecross is providing a safe place within what we are calling the informal segment. And therefore, we're also calling upon parents, because based on that study, the home area will seem to be a risk factor. And now we are almost closing our schools, so we expect the parents to ensure that the home is a safe place so that alcohol and usage onset does not start. Thank you.
NACADA has for many years battled the issue of having liquor outlets near learning institutions. And I know that there's been in the past multi-agency approach towards trying to remove that. How's the situation
now? We have worked with the various state agencies, both at the national and the county level, to try and address the issue of mushroom of alcoholic beverages. Yes, we are doing what we are doing, but it is still a challenge. But the law is very clear. The Alcoholic Drinks Control Act of 2010 provides that any alcoholic outlet should not be within a radius of about 300 meters from an institution of learning. So it is a challenge, but we're working on it with the relevant government agencies. Thank you.